Welcome to today's Medicare 360 show. I'm your host, Jennifer Lee, and we are actually going to finish our journey on the Medicare NU Handbook for 2025. And actually, the Medicare NU 2026 just came out. So if you do want this PDF, let me know. I could definitely send it to you. And we'll probably do a Medicare New 2026 guide and so forth. But you are supposed to get this in the mail and you could review everything. I will review all the updates if there is any. And then at the end, you're going to see a bunch of different plans in your area. It may be confusing, so that's what I am here to help you with. So let's get started. We are on page 113 on Railroad Retirement Board. So if you get benefits from RRB, call to change your address or name, check eligibility to sign up for Medicare, replace your Medicare card, or report a death. And you could actually have questions or comment about this book. You can email Medicare NU at cms.hhs.gov. Okay, let's talk about state health insurance assistantships. This is going to be numbers depending on your state. I know that they were trying to defund this program. So let's just kind of look on the Medicare New Handbook right now and see if it's on there, right? Might as well. So let me go to the new Medicare and New Handbook. Do I see anything? Important contacts. Let's see. You know what? I actually don't. So, yeah, after that page basically where let's see, the Railroad Retirement Board number is the same, but there's no more ship assistant programs that I see on here. So maybe they have defunded it. Let me get back to you guys on that to make sure that is accurate. But of course, call your local agent, call me so we could go over your options instead of SHIP, which is basically, what do they say? Visit shiphelp.org or use the information below for free personalized help with questions about appeals, buying other insurance, choosing a health plan, buying a Medigap policy, and Medicare rights and protections. So the thing is, these are volunteers. Okay, they're volunteers. So they're not licensed. They're not life and health licensed. They don't take continuing education like a licensed agent does every 2 years, an independent licensed insurance agent. They don't do the AHIP. AHIP is a certification that if you want to offer Medicare plans, you do have to take. So they don't have that. So how knowledgeable are they? Right? I mean, yes, you may have your own plan, but everyone is going to be different. Everyone's situation. So I don't know what type of training they've had. So yeah, I would just leave it at that. I think they have been defunded. Let's see. Have they be defunded? Defunded. Let me just make sure. Oh, you know what? Actually, it wasn't defunded. They did suggest maybe lowering the funds to the program. And but look I don't see it in the Medicare New Handbook. So I will next time just let you know if I do see it, but I do not see it on this one. Okay, so it's all the states on there. Not going to read through the states. So let's go on page 119, which is the definitions. So I'm going to just kind of list out the definitions that they have here. So Accountable Care Organization, ACO, group of doctors, hospitals, and other healthcare professionals working together to give you high quality coordination service and healthcare. Okay. Assignment an agreement by your doctor, provider, or supplier to be paid directly by Medicare to accept the payment amount Medicare approves for the service and not to bill you for any more than the Medicare deductible and coinsurance. This is definitely important because you don't want to go to your doctor, specialist, any other health facilities, and if they don't accept assignment, you are going to be on the hook for that service. So just keep in mind that they should. It's normal practice, but you just never know. Okay, benefit period. The way that original Medicare measures your use of hospital and skilled nursing facility services. A benefit period begins the day you're admitted as an inpatient in a hospital or skilled nursing facility. The benefit period ends when you have gotten any inpatient hospital care or skilled care in a skilled nursing facility or for 60 days in a row. If you go into a hospital or skilled nursing facility after one benefit period has ended, a new benefit period begins. You must pay the inpatient hospital deductible for each benefit period. There's no limit to the number of benefit periods. So this is when you don't have a cap, right? If you go to the hospital and you're on original Medicare, you don't have a cap if you go there again in 5-10 days. So keep that in mind. Also keep in mind that just if, let's just say your plan says, oh, you have unlimited day stay or 90-day or whatever stay you have, that doesn't necessarily mean that the hospital is going to keep you there because you're covered, right? If you think of it on the hospital's point of view, it is racking cost for them, right? For you to be there. So you have to be your own advocate on that. Meaning, if you don't want to be discharged, if you're not quite ready to go home, you need to advocate for yourself on that. Some case managers, I would say they're really good. They will help you, they'll advocate for you, but there's just some that aren't. And maybe it's based on what they're told to do, right? So I'm not really involved in that side, but what I could say is that definitely advocate for yourself. Like I had a situation where my client has been at the hospital for a long time, maybe nearing 60, 90 days, and the hospital is trying to kick him out. They're trying to get him more care, like at a skilled nursing facility, a rehab place. And they're just like, yeah, you have to go home. I mean, in so much words, right? Like emotionally, you're already feeling distraught, but we're gonna have to discharge you because insurance didn't approve it. So I'm like, it doesn't sound right. He, this person had unlimited care coverage for the hospital. So we did call the insurance company, and come to find out, the insurance company says we never received a referral for the request to get into a skilled nursing facility. So things like that, I mean, come on now. The case manager could have helped and figured out like why wasn't it approved? Well, it wasn't approved because they never received the request, right? So things like that, you definitely need to just keep your ducks in a row, give us a call. We're here to advocate for you and figure out what's going on, right? Especially for those that this is not your line of field. Healthcare on just taking care of the patient is not my line of field. Like I wouldn't know, right? But on the insurance side, this is something where we could file appeals, complaints, help you get the care that you deserve and that is actually on your evidence of coverage. So things like that that we could definitely help you out with. So that was my rant for that. Let's go to coinsurance. So coinsurance is an amount you pay, an amount you may be required to pay as your share of the cost for benefits after you pay deductibles. Coinsurance is usually a percentage, for example, 20%. So let's take, for example, on Part B medical, right? If you are on original Medicare, there is a deductible for the whole year, and this is the calendar year, not like when you got on the plan in 1 year. It is the calendar year. You do have to pay that deductible. Then after that, you have a coinsurance of 20%. So meaning if you had $100,000 surgery, you would pay 20% of that, which is 20,000. That's a big amount for most people, I would say. So that's why I really don't recommend you stay on original Medicare. So co-payments, what's the difference between a co-payment and a co-insurance? So a co-payment is the amount you may be required to pay as your share of the cost for benefits after you pay any deductibles. Co-payment is a fixed amount like $30. So sometimes you'll see, oh, I want to see a specialist. It's going to cost you $5, $10, 20, 30, or like it's going to cost you zero. So kind of just depends on the plan itself. Okay, so credible prescription drug coverage. Prescription drug coverage that's expected to pay on average at least as much as Medicare drug coverage. This could include drug coverage from a current or former employer, union, TRICARE, Indian Health Service, VA, or individual health insurance coverage. So this is what you need, credible prescription drug coverage so you don't get penalized when you get your Medicare. Because remember, if you don't have a credible drug coverage when you get on Medicare, you will pay 1% for every single month that you weren't on one. And I think the average right now is about $32 annual. So while it could just be pennies, this actually is monthly penalty and you're going to pay it for the rest of your life. So who wants that? Let us know and we could help you with that as well. Critical Access Hospital, a small facility located in a rural area more than 35 miles or 15 miles if in mountainous terrain or in areas with only secondary roads from another hospital or critical access hospital. This facility provides 24/7 emergency care, has 25 or fewer inpatient beds, and maintains an average stay of 96 hours or less for acute patients. Okay. Deductible. The amount you must pay for healthcare or prescriptions before original Medicare. You pay Medicare Advantage plan, your Medicare drug plan, or your other insurance begins to pay. So keep in mind that you do have like a Part B deductible. Some plans, if you get on a Medicare Advantage, don't have deductibles. Some do, more so maybe like on a PPO model. And remember, you do have a deductible on your drug plan. The drug plan is the deductible could go up or down every single year. It is going to go up next year. So that's why it's good to review your drugs and make sure that you're not paying a lot for that if you don't have to. Okay, demonstrations. Special projects, sometimes called pilot programs, or research studies that test improvements in Medicare coverage, payment, and quality of care. They usually operate only for a limited time for a specific group of people and specific areas. Okay. Extra Help, a Medicare program to help people with limited income and resources pay Medicare prescription drug program costs, like premiums, deductibles, and coinsurance. So yes, if you have lower income, you are on Medicaid or Medi-Cal in California, you will receive extra help. So example, let's just say your prescription drug costs $45, but on this plan, you're going to be paying $10. The Part B premium, these plans may be able to pay for that premium as well, so you don't have to worry about it. So those are the nice things about the plans. Formulary, a list of prescription drug covered by prescription drug plan or another insurance plan offering prescription drug benefits, also called a drug list. So the biggest thing is that every insurance company will have their own formulary. From one drug on one plan to a different plan might not have the same cost. It might not even be on the formulary, which means it's not on their list and it's not going to be covered. And then the pricing is going to be different. So just keep that in mind. Not everything's always covered. Most of the time, the generics and the preferred generics are covered. Brand name could be shaky, but sometimes one company will have a discount or make a brand name drug cheaper. So things like that to look out for. Okay. Inpatient rehabilitation facility, a hospital or part of a hospital that provides an intensive rehabilitation program to inpatients. Lifetime reserve days. In original Medicare, there are additional days that Medicare will pay for when you're in a hospital for more than 90 days. You have a total of 60 reserve days that could be used during your lifetime. For each lifetime reserve day, Medicare pays all covered costs except for daily coinsurance. Okay. So you have a total of 60 reserve days, right, during your lifetime. So that's kind of crazy. Imagine being at the hospital last 5 years, next 10, 15, right? You're going to be on the hook for that if you don't have a plan. So definitely suggest not being on original Medicare. You never know your expenses. Long-term care hospital. Acute care hospitals that provide treatment for patients who stay on average more than 25 days. Most patients are transferred from an intensive or critical care unit. So yes, like when you're at the hospital and you need more care, I would suggest going to a long-term care hospital. Of course, you may need approvals and referrals to go to one. So that's why your plan is very important to that, and making sure everything connects together when you are at a hospital and you get those approvals. Medicaid, a joint federal and state program that helps with medical costs for some people with limited income and in some cases, resources. Medicaid programs vary from state to state, but most healthcare costs are covered if you qualify for both Medicare and Medicaid. Medically necessary, healthcare services or supplies needed to diagnose or treat an illness, injury, condition, disease, or symptoms that are accepted standards of medicine. Okay, so medically necessary, typically that is, a term that Medicare will use. They won't pay out if it's not medical and necessary, like a cosmetic surgery. Medicaid, I kind of just breeze by that. So let's read that again. Medicaid, a joint federal and state program that helps with medical costs for some people with limited income, and in some cases, resources. Medicaid programs vary from state to state, but most healthcare costs are covered if you qualify for both Medicare and Medicaid. So remember, this is for low income, and there's going to be different requirements based on your state. And then you are able to have more resources. You may get more on your plan because you're on Medicaid, and in California, Medi-Cal. Okay, Medicare Advantage Plan Part C. A type of medical health plan offered by a private company that contracts with Medicare. Medicare Advantage plans provide all of your Part A and B benefits with a few exclusions. For example, certain aspects of clinical trials which are covered by original Medicare, even though you're still in a plan. Medicare Advantage plans include health maintenance organizations, preferred provider organizations, private fee-for-service, special needs plans, and medical savings account plans. So acronyms on that: health maintenance organizations, HMO, preferred provider organizations are PPOs, private fee-for-service plans are PFSP plans, special needs plans are SNPs, and medical savings accounts are MSAs. If you are enrolled in a Medicare Advantage plan, most Medicare services are covered through the plan. Most Medicare services aren't paid by original Medicare. Most Medicare Advantage plans offer prescription drug coverage. Medicare approved amount. The payment amount that original Medicare sets for a covered service or item. When the provider accepts assignment, Medicare pays its share and you pay your share of the amount. Okay, that's straightforward. Medicare Health Plan. Plans offered by private companies that contract with Medicare to provide Part A, Part B, in many cases Part D benefits. Includes Medicare Advantage plans and certain types of coverage like Medicare cost plans, PACE programs, and demonstration/pilot programs. Medicare plan. Any way other than Medicare, original Medicare, that you could get your Medicare health or drug coverage. This term includes all Medicare health plans and Medicare drug plans. Medigap. Medicare supplements insurance sold by private insurance companies to fill gaps in original Medicare. So these plans aren't Medicare Advantage plans. They just fill in the holes or the gaps that original Medicare doesn't cover. So very different from Medicare plan. Let's see. Okay, original Medicare, a fee for a health service insurance program that has two parts. Part A, hospital insurance, and Part B, medical insurance. You typically pay a portion of the cost for covered services as you get them. Under original Medicare, you don't have coverage through Medicare Advantage or any other type of Medicare health plans. So that's OM, which is original Medicare. I thought we were gonna finish this episode, but I guess not. So wow, we will continue next week on page 122. So going over the definitions, and I think we will be done by next week. And at least I could definitely just give a recap on it as well. Well, once again, thank you for joining us. I'm your host, Jennifer Lee with Medicare 360. Look forward to seeing you next week. You have a great day.